As the focus on the quality improvement of nursing care and processes heightens in the modern healthcare setting, it is the goal of the Quality Improvement Council to provide education to clinical staff on current practices for data collection and performance evaluation to ensure standards of care are being adequately met. As newly hired nurses in this healthcare facility, the following audio presentation has become mandatory pre-employment education material in an attempt to share important information on the ways in which this data is collected, evaluated, and distributed. At the completion of this audio recording, you will be able to define nursing-sensitive quality indicators, explore an example of a specific nursing-sensitive quality indicator, explain collection and distribution methods at this facility, and expand upon the nurse's role in an accurate reporting of collected data. When beginning to research these points of data collection for evaluation of nursing quality, it is first helpful to look to resources such as the National Database of Nursing Quality Indicators, or NDNQI. This database, according to northwesternmedicine.org, is a resource regulated by the American Nurses Association, which serves as a local point of collection and evaluation of facility-specific data on nursing-sensitive quality indicators. Nursing-sensitive quality indicators, as explained by the World Federation of Critical Care Nurses, are a collection of defined patient outcomes that are thought to be directly related to the quality of provided nursing care at any given facility. These nursing-sensitive quality indicators, which consist of 10 specific categories developed by the American Nurses Association and monitored by regulatory bodies such as the Joint Commission, include hours of nursing care provided to patients, quantities of RNs, LPNs, and unlicensed assistive personnel in the care setting, pressure ulcers, reported rates of nursing staff satisfaction, hospital-acquired infection rates including CLABSIs and CLAUDIs, falls, and levels of patient satisfaction with general care, quality of provided health education, pain management, and nursing care specifically. In this audio training, pressure ulcers as a nursing-sensitive quality indicator will be explored in depth in order to express the importance of vigilant adherence to evidence-based methods of prevention to ensure provision of quality nursing care at this facility. Pressure ulcers, as explained by the Mayo Clinic, are injuries which occur to the skin and subcutaneous tissue as a direct result of pressure that is applied to the skin for an extended period of time, presenting in a range of severity from stage 1, or mild, superficial, non-blanchable redness, to stage 4, or complete involvement of all skin layers, including exposure of muscle and bone tissue. Pressure ulcers commonly occur in areas where direct pressure is applied when resting in a bed or chair for a prolonged period of time, including the posterior head, shoulders, elbows, sacrum, or heels, for example. Risk factors for pressure ulcers include decreased ability to adjust position due to weakness or immobility, moisture related to incontinent episodes, decrease in quality of sensory perception, such as in diabetes or spinal cord injuries, for example, inadequate nutritional status, and poor circulation. When left untreated, pressure ulcers can result in very serious complications, including infection of the skin, bone, and muscle tissues, potentially progressing to the point of sepsis. Pressure ulcers are preventable, however, with diligent efforts at repositioning, skin care, and pressure disbursement by nursing staff, and are therefore considered a nursing-sensitive quality indicator by the American Nurses Association. This patient outcome is a very important quality indicator to monitor, as patient safety is compromised when poor nursing care allows this type of skin breakdown and exposure to potentially fatal infections. As new nurses at this facility, it is imperative that you are familiar with methods of recognizing and preventing skin breakdown in the very early stages in order to prevent infection, provide quality nursing care, and promote optimal patient outcomes in general. In order to better understand the ways in which data on this nursing-sensitive quality indicator will be collected and distributed as you begin your career, an interview with the current staff nurse informaticist was conducted to discuss methods of monitoring already in place at this facility. When asked about monitoring of pressure ulcers, the nurse informaticist first shared that it is of utmost importance to utilize available resources among the interdisciplinary team prior to documenting the presence of a pressure ulcer in order to prevent associated financial ramifications. For example, this would mean that if you are unsure if a skin lesion is actually a pressure ulcer, A consult to the wound care team would be appropriate prior to documentation, due to the fact that pressure ulcers are considered to be a hospital-acquired condition by the Centers for Medicare and Medicaid Services, and reimbursement for treatment of the injury will not be received. In order to ensure rates of hospital-acquired pressure injuries are accurately documented, it has become a mandatory practice at this facility that a 2-person skin check be performed by 2 registered nurses at the time of admission to note any pressure ulcers that are found to be present prior to admission, which would thus relieve hospital staff of liability for the wound and prevent financial repercussions. For pressure ulcers that develop while under the care of nursing staff of this facility, the interviewed nurse informaticist shared that monitoring technology is utilized in this hospital's nursing units to track rates of pressure ulcer occurrences. One of these technologies includes required skin and wound assessments in the electronic health record. As supported by the Agency for Healthcare Research and Quality, these assessments are performed daily by the assigned nurse, as well as weekly and more in-depth by the wound care team for further recommendation on dressing and treatment of pre-existing or newly developing wounds. As explained by the nurse informaticist in this conducted interview, the incidence or number of patients with new pressure ulcers compared to total admissions to the unit, as well as prevalence or percentage of patients with pressure ulcers on each unit out of the total patient population admitted, is calculated and tracked by the nurse informatics team based on reporting through these wound assessments in accordance with recommendations by the Agency for Healthcare Research and Quality for quality improvement purposes. Once this data is collected, it is translated into charts for the purpose of trending data and distributed to unit managers on a monthly basis for evaluation at monthly Quality Improvement Council meetings. Units with especially high rates of hospital-acquired pressure ulcer occurrences are then required to repeat training on methods of prevention to ensure best possible patient outcomes, safety, and satisfaction are being achieved. As members of the interdisciplinary team, you play a very important role in the adequate monitoring of outcomes related to this nursing-sensitive quality indicator. It is therefore essential that you are performing thorough, accurate daily assessment and documentation of skin condition and presence of breakdown to ensure any pressure ulcers are noticed early and accounted for so any compromise in quality of care can be promptly addressed to prevent further alterations in the provision of the highest possible quality of patient care by nursing staff. Additionally, it is again of utmost importance to utilize the wound care team as a valuable interdisciplinary resource prior to documentation of pressure ulcer presence, as false documentation of this hospital-acquired condition can lead to financial strain on this healthcare organization. Through strict adherence to assessment and reporting guidelines surrounding this nursing-sensitive quality indicator, evidence-based practice guidelines can be developed by the Quality Improvement Council for promotion of better patient outcomes, safety, and satisfaction. For example, when specific nursing units with especially high rates of hospital-acquired pressure injuries are identified through data collection and distribution via assessment and monitoring technologies implemented in the electronic health record, directed education can be provided on methods of repositioning, skin care, pressure alleviation, etc., in order to prevent further occurrences. In this way, the quality of nursing care at this facility is optimized, and nursing staff are incorporated in an attempt to build accountability and minimize adverse outcomes in general.